Today I'll discuss about breast cancer. Breast cancer is the most common cancer in women worldwide, though sometimes it occurs in men also. In fact, in India, it is the second most common cancer in women after cervical cancer. Now, as an oncologist, I really feel proud that in the last 15-20 years, we have really made important strides, particularly in the management of breast cancer. And it's really heartfelt to see that many of our breast cancer patients are getting cured and more people are actually living better lives. In India, if we say, around 1 lakh ladies per year contract this disease. Breast cancer, though, does not have any particular risk factors, so majority of the patients might not have any risk factors. However, around 10% of patients will have either a familial history or the breast cancer will be genetic in nature. There are some associated risk factors which include being a female, so that is the most common, then increasing age. Most of the breast cancers occur after age of 40 to 50. A family history, early menarche, late menopause, or having the first childbirth after 30 years of age, having obesity, or having a sedentary or stressful life. These are the factors which increase the risk from normal population to 2 to 4-fold. Also, there are some certain high risk factors like previous exposure to radiation in the adolescence period, or having postmenopausal hormone replacement therapy. Now, coming to the signs and symptoms. The most common signs or symptoms include a lump in the breast, which is usually noticed accidentally or by the lady when she is examining herself or self-examination. Apart from the breast lump, there can be other symptoms which include nipple retraction or discharge from the nipple, which can be serous or having a bloody discharge. There can be changes in the skin. There could be lump in the axilla. So these are the most common symptoms which with the ladies present with the breast cancer. And if somebody has got these symptoms, she should immediately contact her doctor. Once we see the patient, we order tests, and the most important or basic test is a mammography. Depending upon the report of mammography, if the mammography is suspicious, a biopsy is done, and further tests are depending upon the stage. Further additional tests including a bone scan and staging of the abdomen and chest can be done by the treating physician. Now, once a lady is diagnosed with breast cancer, the treatment includes two things. One is a local treatment and second is a systemic treatment. Local treatment has two components. Almost all ladies will require surgery if they present with a localized disease. Surgery is in the two forms. One is a modified radical mastectomy, or the whole of the breast is removed along with the axilla. And the second is a breast conservation surgery, which is usually preferred in majority of the ladies because breast can be conserved and there is less morbidity with this procedure. So after the surgery is done, most of the ladies are referred to the chemotherapy specialist, and they receive chemotherapy, and some of the ladies receive immunotherapy along with chemotherapy. In certain groups, radiotherapy is added as an additional local therapy in certain groups, and this is followed by hormonal therapy for an extended period of around 5 to 10 years in ladies who have hormone receptor positive breast cancer. In the today's era, with the latest state-of-art surgery, better radiation techniques, and the latest drugs which have come in the chemotherapy armamentarium, we are achieving very high cure rates and very good control rates even in advanced stages of breast cancer. The future is really bright, and I'm very hopeful that with all the newer drugs and advances, we will be able to have maximum control of disease and will be able to prevent this in majority of our population through proper screening programs. Thank you.